Good evening. My name is Jennifer Stretton, and I'm a member of the CANIBD Steering Committee, and I'd like to welcome you all to tonight's program. I'd like to start by extending a warm welcome to our guest speakers, Dr. Riehl and Dr. Basran, who will be speaking tonight. I'd also like to extend a thank you to our sponsor, Takeda Canada. Both Alexandra Walsh and Catherine Finlayson have been such champions of CANIBD and have worked very, very hard to bring us tonight's program. Next slide, please. Just some housekeeping information. So on the screen ahead of you, you'll see some tips on any problems you might be having with the webinar. You do have an email address there for our coordinator at Fusion who can help you if you are having any technical problems. Just to let you know that we will be muting all the participants throughout the presentation, but at the end during the Q&A period, we will open it up for questions. We would like you to submit your questions through the chat room, but if time permits, we may open up the speaker to allow you to ask questions directly to our speakers. Just to let you know also that this webinar is being recorded. Next slide, please. These next two slides are disclaimers from Takeda Canada. Next slide. Next slide. And these are our speaker disclosures as well. Next slide. Before we begin though, I just wanted to take a few moments to wish all of the nurses attending this evening's program a really happy Nurses Week. The theme of Nurses Week this year is We Answer the Call, and nurses have been answering the call over the past year like never before. Your kindness, your strength, your commitment, leadership, and perseverance during one of the most difficult times in modern history is so evident. Thank you all for your exemplary leadership. Thank you for stepping outside of your comfort zone. Thank you for working harder and for longer than any of us could have predicted. And thank you all for everything you do and when you especially are needed the most. Thank you. Happy Nurses Week. Given the experiences we've had over the past year, I think tonight's program is so timely and so relevant for all of us. We tend to commit so much of ourselves to our patients, our family, our friends, and sometimes we neglect our own wellness. So tonight's program, I hope you can enjoy it and take some information back and take care of yourselves. I'd like to first welcome our speaker, Dr. Riehl. Dr. Megan Riehl is a GI psychologist who specializes in psychogastroenterology and anxiety-related disorders. She is a clinical director of the GI Behavioral Health Program at the University of Michigan. And director of Behavioral Health Services and Support for GastroGirl, Inc. and GI On Demand. Dr. Riehl's clinical research focuses on the delivery of GI behavioral health treatment for patients with disorders of the gut and brain and IBD. Dr. Riehl participates on several national committees dedicated to research and education to enhance the psychosocial functioning of patients with gastrointestinal problems. You can follow her on Twitter and Instagram at Dr. Riehl. Thank you very much and welcome, Dr. Riehl.
Thank you so much, Jennifer, and to the organizers. I've been really excited to participate tonight with Dr. Basran. And as you've mentioned, I think this certainly falls during a timely week where we really thank who are really the field work, the groundwork, and the important work, the frontline work with our patients. I am a GI psychologist, so I specialize in working with patients that do have inflammatory bowel disease, as well as other functional GI disorders of gut-brain interaction. So I miss seeing my IBD nurse colleagues that used to have offices right next to mine, but I'm now coming to you from my home office. and what a year we've had. So I'll be talking tonight about mental health and resilience building among those of us that are working with patients with gastrointestinal issues. And I hope over the next 30 minutes or so, we can kind of talk a little bit about why all the work that you do is so important, and that much more important to take care of yourself. So some of my objectives are to talk a little bit about stress on the mind and body and bring some awareness to burnout. We'll also be talking about fostering and recognizing resilience that each and every one of you, I'm sure, has. And then I will be handing over the rest, after a brief break, I'll be handing over the rest of our time tonight to Dr. Basran, who will introduce some really important concepts around mindfulness. So I want to review a little bit of a timeline and think back to February of 2020. And these are kind of very true quotations that I recalled that were prevalent and probably will resonate with many of you as we were just starting to get information about the pandemic. So thinking back, that there were those that said, you know, this probably isn't going to impact us much. And there were those that were saying, I think this is probably really going to impact us a lot. There were those, and I even had conversations with my own patients in our GI clinic saying, you know, right now, as of February, let's be more concerned about getting you your flu shot. My family was excited to go on our first spring break with my little ones, and we were planning to go to Disney for the first time. We were talking about how nice it was to see people at a friend's baby shower where we were passing around food and sharing drinks, and had a bunch of people all together in one house. And what a great weekend experience that was. Another female colleague of mine was talking about what a busy week she had coming up with a science fair and Kumon school and indoor soccer and, you know, so much going on, and that they were really going to need the help of both babysitters and parents and loved ones to help with childcare. And you know, I think we all probably can also remember that, you know, that there was no hand sanitizer or toilet paper at the store today. Can you even imagine that? And then this is what I pulled up to about a month later at my place of employment at Michigan Medicine. I literally stopped my car to take a picture of this white tent and the drive-through testing that had been established to assess some of the first patients with COVID. And then, you know, life really started to change, and the world as we knew it as of around March 20th of last year had changed completely. There was a sense of fear, there was a sense of unknown, there was a sense of anxiety, and there was a reality that what we were about to endure was something that none of us had really been prepared for, whether it be in nursing school, medical school, or graduate school. So as the pandemic really started to unfold and the realities of our new normal started to kind of come into play, initially we had, you know, the toilet paper scares, right? I remember a neighbor saying, oh, I saw that you had some paper towel in your garage. Could I trade you a paper towel for a toilet paper? Because I don't know when I'm going to get paper towel again. We began to look at the realities of, you know, schools that had shut down for a week or two. It was becoming clear that school was not going to be returning right away. People began to experience, and we started to see in our patients, the burden of the pandemic and the stress that it was causing from financial perspectives to unknowns around jobs and to fear around how to carry out some jobs that you know, were really considered dangerous in terms of being out in the public. And as the months unfolded, we started to experience the stress, the worry, the loss, and the impact of the pandemic on the people in medical work that were on the front lines, and even those that, because many of my IBD nurse colleagues, some were working from home, fielding questions and concerns from our IBD patients. Some were still in clinics, and some were still seeing patients face to face. Everyone's experience was slightly different, but everyone was experiencing a great deal of stress. So fast forward to over a year, we've been entrenched in this pandemic. And now we're sitting in a place of being sent back to work or remaining home, to vaccinate or not to vaccinate. Schools are opening, schools are closing. We're in the US and other places in the country, and certainly around the world, surges continue. We have those that are heading off on spring breaks, and we have those that are grounding them to eat in restaurants or to continue with takeout and avoid restaurants. And all on top of that, we've experienced political stress, strain, social injustice, and a very polarizing time for our world. So to say that, stress doesn't help anything is the reality here. And as I go through the rest of my talk tonight, I really want you to conceptualize things in a way that many of the things that I'm saying to you as nurses, and really honing in on taking care of yourself, many of these things are impacting the patients, and you're hearing this on a regular basis. So with that, knowing that, nurses are not immune to any of these things, but yet you're also dealing with patients who are also dealing with each of these things, has led to, excessive workloads. At different times, there's been concerns over inadequate PPE, inefficient infection control systems, so worrying about our environment. In the study that I'm referencing here that looked at the impact of COVID-19 on the mental health of nurses, these were some of the reports by nurses that were on the front line of treating COVID patients. And so I will highlight that some of the statistics around the psychological toll of being a nurse during COVID-19, some of these stats are associated with those that were frontline workers. But nonetheless, it trickles down to impact our medical society in general. So continuous stress can lead to burnout, PTSD type symptoms, anxiety, depression, poor delivery of our services, and at the most severe end of things, suicidal ideation and completed suicide. So just briefly, what is burnout? And burnout is a psychological manifestation of these three things. So physical and emotional exhaustion that can come in the form of fatigue, insomnia, loss of appetite, anxiety, and/or depression. Detachment, which is a loss of enjoyment, pessimism, and isolation. Ineffectiveness and lack of accomplishment. And we see this in the forms of hopelessness, apathy, irritability, and lack of productivity. And so while we may not see, or you may not see yourself as reaching the threshold for all three of these categories, at some point over the pandemic, most people have experienced something on this list. And our goal is to prevent that burnout. In a recent, actually in a study in 2019, so that's really important, a date to highlight, that these are statistics that took place during a survey study that happened before the pandemic. So we don't have this survey research post-pandemic or even where we're at in terms of the pandemic right now. But this is where nurses could have been and kind of were, according to this survey that was completed and included almost 2,000 nurses across several 37 nationally representative hospital facilities. When we look at these stats of burnout, it's a very high number. And what I'll draw your attention to as well is that even when people were approaching burnout, they still were remaining in their job. And what does that do? What that highlights is it shows this diminished capacity for nurses to take care of themselves, which then impacts how they take care of others. And so it's so important also that we not put the onus on just the nurse. And that's what I also want to highlight, that as we come up with solutions and strategies to address burnout and high stress, ideally it's going to happen at an organizational level. But tonight, since that would take up far more time than the 30 minutes that I have, I'm hoping to give you some insights and some suggestions on just taking an assessment of where you're at so that you can make some adjustments if needed. So with stress in our body, obviously it's normal to experience stress sometimes, but it's really the long-term effects of stress that can impact us from that physical, emotional perspective, which also then leads to unhealthy behaviors. Within our GI community, as the pandemic was unfolding, we started to also see how there was a connection between gastrointestinal symptoms and COVID-19. So we were seeing increased office visits, increased requests for visits, and among the IBD patient population, certainly there was additional concerns about the potential impacts of what would it mean if I contracted COVID-19? Should I continue with my medications? Should I change my medications? So I'm sure that in terms of workload, many of you experienced these, and really patients were starting to experience increases in anxiety related to the potential of what it meant to have a chronic illness in addition to living in a pandemic. So when we think about the brain-gut axis and the major effects of stress on our gut physiology, not only are we susceptible to some of these changes, but we also are dealing with patients that are more susceptible to GI distress when it comes to their experience with stress. So when the body and the mind are under stress, we can see increased alterations in gastrointestinal motility, an increase in visceral perception, so how much you're feeling your symptoms. We see changes in gastrointestinal secretions, increases in intestinal permeability, impacts on our ability to heal, and then negative impacts on our intestinal microbiota. So as many of you likely experience with your patients that are going through something difficult or stressful, they're at more risk for flare. And in terms of our own mind-body connection, when we're under stress, you may have found that you yourself were impacted from a physiological perspective. So the types of stress that rev our response, and when I say rev our response, that can be in the form of our body's fight, flight, or freeze response. So our brain-gut connection leading to sympathetic arousal, that really made it the most, kind of resonated the most with the pandemic for life threats. So I could contract COVID. If you were somebody that needed to go into a hospital on a day-to-day basis, worrying about putting your family members at risk. Daily exposure to emails from your institution about prevalence rates and death tolls. You also may or may not have experienced loss. So worry about your patients, potentially having a patient die from COVID, feeling like your role that you were once in, you may have been triaged to a different responsibility. Values being challenged based on what you were being faced in terms of your work. Also inner conflict, so being unable to prevent harm to others. Wear and tear, meaning long hours, less sleep, anxiety, depression, increased changes in your workload, and again, just the accumulation of prolonged stress. So I wanted to present you with, again, an initiation, an introduction of some evidence-based models that in some institutions were being implemented in order to acknowledge the burnout, the potential of burnout, the role of stress, the impact that the pandemic was having on those working in hospitals and in medical systems. And one model, and as you'll see, a lot of these models are coming from military settings. So taking kind of front line from a military perspective, strategies and evidence-based models, and applying them in a way that makes sense in a medical setting. So the PIES model refers to proximity, immediacy, expectancy, and simplicity. And so one example of how this model may be applied, if say a charge nurse begins to see that one of their nurses is really beginning to struggle. The goal with proximity is to keep the staff member engaged and remaining close to their team. So giving them time off may not be the right strategy, but seeing if we can alter their responsibilities while still supporting within a team environment. In terms of immediacy, providing help before the distress of the individual or the team escalates to crisis. Expectancy is acknowledging that many of the emotional and physical responses that people during the pandemic were experiencing were totally normal. And then we want to keep our interventions as simple as possible. So in this kind of occupational health approach, it's supporting the individual to continue working where they can and building their self-esteem and their ability to cope with a situation that is distressing, but yet may not be going away anytime soon. So stress first aid is another example of assessing your own level or another team member's stress response. And what you'll see here is that stress certainly happens on a continuum. And our goal is early awareness and response so that we can bring someone back to a kind of zone that they are able to accomplish their work. So this is a model that, again, was developed by the Navy and the Marines, and is part, it's called the stress continuum model, which is part of psychological first aid. And as you kind of look, and in a couple minutes, I'm gonna help you to do a little bit of a self-assessment. Our goal is to prevent people from getting to orange and red, and to identify that not everybody's going to remain in green all the time. We kind of vacillate between being in the green, where we're at optimal functioning, we have excellent wellness, people feel really motivated, they're focused, they're calm, they're having fun at work. It's really hard to stay here. And in the last year, we've certainly had a lot of people that are revving into that yellow, orange, and certainly we want to prevent people from being in the red and make sure that we get them the resources as soon as we can. Some of the ways that we can employ or deploy psychological or stress first aid is using the 7 C's. So checking with others, coordinating, getting them help if needed, getting them coverage if necessary, calming them down, connecting, creating an effective competence, and getting the person back to a stage where they feel confident that they can do their job. So under significant stress, we can kind of cover these 7 C's by working together, checking in, and also being mindful of how you're feeling. So as I said, rather than placing the onus of wellness on one person, entire organizations really need to work together. And that healthcare organizations, associations, and societies need infrastructure to focus on promoting well-being. And that's where I think even just having a webinar like tonight, hopefully each of you can take back some of these ideas, these concepts, these strategies to your own institutions to identify that there are some things that we can do to promote wellness. At Michigan Medicine, where I work, during the beginning of the pandemic and throughout, we had psychologists that were checking in on floors, actively engaging in creating safe spaces, utilizing some of these strategies for really anyone, whether you be a scheduler, a medical assistant, somebody that is checking patients in and out, a nurse, or a physician. So we really disseminated aspects of psychological and stress first aid in many of these other ways. And we also found it very helpful to connect with town halls, developing a weekly wellness newsletter with some very brief, short suggestions, such as some mindfulness techniques for our nurses and faculty to utilize during this stressful period of time. We were virtually providing support and happy hours to connect with our peers. We made peer-to-peer support available. So it wasn't like the person was saying, you know, I need you to be my therapist, but more so, can we just talk and check in with each other? And we also employed a stress resource team that would check in with people that were reaching more of those orangish, kind of on the stress continuum spectrum, to make sure that we were getting them the resources that they needed before reaching a threshold of red. So as you can see, and Dr. Basran will give us a few more nitty-gritty suggestions and techniques that you can take away. But if stress reaches a level of that orange and red, it certainly is going to impact your mental health. And May happens to be Mental Health Awareness or Mental Health Month. And with nearly 47.6 million adults in the US, I'm sorry, I couldn't get the Canadian data quick enough, but I would assume that the numbers are similar. Many people are affected by mental illness every day. And I always say that those of us that are delivering services and are caregivers, we are not immune. And in fact, because we carry so much and we give so much, we're actually at increased risk, and especially as women. So it's okay to take time to validate that, you know, maybe you had a little more time at home because of the pandemic. And it's okay to be grateful for your health and family time and slowing down, but also that over the course of the pandemic, many people were feeling exhausted, they were feeling stressed, they were feeling trapped, and they were feeling worried. And so I guess what I'm asking and what I'm showing you here is if it's okay for me to share my personal experience, because these are my two little guys. And over the last year of working, I've had the same feelings. I've been giving as a mental health provider, but I've also been giving to two little ones that have had to have their little world changed. And when it comes to the pandemic, we have seen statistics showing women have been more impacted because of this mental load of motherhood or other experiences that women have, especially those in the field of medicine. So it's okay to have those vacillating feelings. Now, the importance of checking in with yourself and having more frequent check-ins with yourself during this period of time is so important. So start with yourself. Start to ask yourself, especially if you're feeling some of those early signs of burnout, how am I doing? And what do I need? And then you can kind of cycle through your community with your colleagues and kind of moving through with friends and family to do check-ins with them as well. Here's another assessment that, and I think you all will have access to these tools or this PowerPoint, but looking at some of the indicators that stress is impacting you. So are you experiencing changes in eating habits, willpower? Are you drinking more? Are you having more conflict with loved ones? Are you having some cognitive changes? There's a whole list here. And again, it might just be a couple things that you notice have changed over the last year. And from there, you can ask yourself, do these things help me? Does it align with my value system? Do I need to make adjustments? So I had some colleagues, when we were talking about how are we coping with our stress, that made the list. And a little activity that you can do is to literally make a list. What are all of the things that you're doing to cope with your stress? And I encourage you to write down the good, the bad, and the ugly. So the good might be you are hopping on your exercise bike more frequently. The bad might be you're eating a little later at night and maybe having more snacks. And for you, the ugly might be instead of having a glass of wine, it's turned into 3 glasses of wine. Without judgment, you can ask yourself, is this helping me? And does it align with my values? And if the answer to any of that is, I don't know that it's helping me, that can at least guide you to making some suggestions about what you might want to modify. So if we go back to kind of the stages, and the alarm stages are earlier in that continuum. So this is in that kind of yellow stage, where we might notice that we're having more physiological symptoms of stress with catching our breath. Maybe you notice you're holding more physiological tension in your body at the end of your workday. Many of the strategies that can be implemented can be body relaxation based. As Dr. Basran will talk about, mindfulness, increasing physical activity, limiting your exposure to social media and the media in general, and then focusing on things that are within your control. These are some techniques that you might find that might make you feel a little bit better about how you're coping with your stress. This is another great article that came out last year by some of my colleagues who also happen to be specialists in psychogastroenterology and IBD. So if you've not seen this article, I would recommend checking it out, Gaining Resilience and Reducing Stress in the Age of COVID-19. They give a lot of different strategies that are helpful, not just for patients, but they're all things that we can align with and we can practice on our own. If you're reaching more of that orange-red stage, the exhaustion stage of the stress continuum model, a quick strategy to screen for stress and mood is to use the PHQ-4. And you can do this on your own. You can also, without, obviously with a colleague, you don't have to, sit them down and say, let's go through this questionnaire, but you can allow yourself to have a really honest conversation to see if you're answering almost all of these answers in a positive way, so nearly every day. It likely means that you need a little more professional help in terms of addressing some of the feelings and the experiences that you've had. So when it comes to resilience, our goal is to help manage stress by building and highlighting one's resilience and providing opportunities to enhance your individual growth through positive emotions, acceptance, optimism, empathy, and gratitude. And if all of these concepts seem really foreign and, what does it mean to accept and how do I resonate with all of these optimistic, empathic, grateful feelings when I'm at the brink of my stress? Again, when we work to foster this resilience through different strategies and coping, it helps the body and mind return to a state of safety. And you may be able to do some of this on your own through your own kind of self-work with mindfulness or exercise or making different boundaries around your work-life balance. Or, as I've said, you might reach out to a health psychologist for some guidance and some additional strategies. But the ultimate goal of stress management is resilience. And it's this ability to respond to adverse situations and return to that baseline of optimal health and safety. And so in these last couple of slides, I'll just direct you to an example of, this is a coping card that was produced by Duke Health University. And you could print this out with just some suggestions. Like if you're having a rough day, you could look at these 4 different areas: basic needs, grounding, self-talk, connection, and see if focusing on one of those areas for that day makes you feel like you're getting a little bit more stability. So having this around and aware, and something that you can reach for, a coping card can be really helpful for kind of that day-to-day stress. And then finally, again, through Duke University, and if you go to this link of dukehealth.org, or you type in through Google Duke University Wellbeing Tools, it will pull up their Center for Healthcare Safety and Quality. And they have all of these excellent resources that are free and available to everyone, with lots of well-being tools. And you can kind of see the outline here. And so again, I like to give people reminders that you can cultivate resilience and stress management in 3 minutes a day. But if you reach that orange-red threshold, you're going to need more support, and don't be afraid to reach out for that. So please be kind whenever possible. And as the Dalai Lama said, it is always possible. And remember that the kindness that you extend to others and the compassion that you show them is most important, that you reflect that back on yourself and be kind to yourself and take care of yourself. So I look forward to talking more with you after Dr. Basran's talk today. And thank you so much for this opportunity to kick us off tonight.
Thank you very much, Dr. Riehl. That was really well done. And I think all of us can say we can relate to everything you discussed tonight. And I think some of the experiences and the stresses that you discuss make us actually feel a little bit better, that we're not alone, that it's okay to be feeling this way. And I really like the tools that you provided, and I'm going to work with the team to make sure that we can get those tools out to everybody in attendance, so that they can have a copy for their own personal use, as well as maybe using in their practice as well. So thank you so very much.
You're welcome. I think like the coping card in like putting it in a lunch break area or tacking it up in your cubicle, just kind of inspiring people to not feel like they're alone, because you're not. You are absolutely not alone. And we're all impacted, maybe in slightly different ways. But I think acknowledging that we're all impacted and that we're going to have days where we wake up and think, I don't even know how I'm going to get down the stairs to start my day. But that you say, I'm going to put one foot forward and just get started. It's okay to feel that way.
Yeah, very good. Thank you so much. I think I'm really looking forward to see what the group has to say, but we're going to save all the questions to the end of the program. Right now, though, I think we're just going to take a 5-minute break for people to get a drink or go to the bathroom if they need to, and we'll return in about 5 minutes with our next speaker. Okay, thank you. Good evening and welcome back, everyone. We're going to continue on with tonight's program. Before we begin our next section, I just want to remind everybody that they can put any questions that they have in the chat room, and we can share that with our speakers at the end of the program. Hopefully, if we have some time permitting, for those of you who'd like to speak directly to the group, we will unmute the speaker and you can ask your questions directly. Just ask if you could raise your hand so that we can find you. So now I have the pleasure of introducing our second speaker for this evening. Dr. Basran is a cardiothoracic anesthesiologist and assistant professor at the University of Ottawa in Canada. She is the inaugural director of well-being in the Department of Anesthesiology and Pain Medicine at the University of Ottawa, and is presently in the process of creating a framework of well-being at a university level. Dr. Basran participates on a number of national and international well-being committees, focusing on bringing attention to the importance of addressing physician well-being and assisting in the development of wellness programs across the medical specialties. Dr. Basran has had a long-time interest in mindfulness as a life skill and has become certified as a facilitator of mindfulness-based cognitive therapy through the Center of Mindfulness Studies in Toronto. She facilitates mindfulness-based cognitive thank programs in the Ottawa community at present. Thank you, Dr. Basran, and welcome tonight.
Thank you, Jennifer. And thank you, Dr. Riehl, for an excellent presentation. I learned a lot myself in terms of resources. So I just want to take a moment to acknowledge all that the nurses do, that you nurses have done during this pandemic and beyond. It's a trying time, and we're all having some challenging experiences here, and the processing of these experiences can be quite difficult. Mindfulness is a life skill that I started using informally in the operating room with patients, particularly when I took care of high-risk patients such as heart transplant and lung transplant patients. It was interesting when I had these patients monitored in the operating room while waiting to see if the donor organ was transplantable. I would practice some exercises where we'd pull the patient into the moment, because there was a lot of questions concerning their mortality or what could happen or if they'd see their family again. And it was remarkable to see the emotional impact on the patient doing these practices, as well as the physiological impact on patients. Having them in the operating room monitored and waiting, it was quite impressive that patients would have a physical as well as mental response. And so this is something I've done for many years, and truly believe in the power of bringing your attention to the present moment. So I thought the best way to have a talk on mindfulness is to start with a breathing space practice. It's a short practice. It's a 3-minute breathing space. And I'd like to invite all of you on this webinar with us today to take a moment for yourselves. So I'm going to ask you, if you're open, to find a comfortable position just on your chair, the way you are, or on the floor. Sitting at the end of your seat, closing your eyes if that feels comfortable for you, or just having a downward gaze. And then just checking in with yourself in this present moment. Just becoming conscious of the thoughts that are around. Noting these thoughts as mental events without being pulled into them. Noting any emotions or feelings that are present for you in this moment. And in particular, possibly noticing any challenging emotions that are here for you in the present moment. Rather than pushing away these unpleasant feelings, just allowing them to be here. And then noting any body sensations, any areas of tension, of pulling, of relaxation. And just checking in with the present moment experience. And just allowing it to be here. So now that you have a sense of what's going on for you in the present moment, just gathering your attention at this point and shifting it to your sensations of breathing, either the chest or the belly, noticing the sensations of the belly moving up and down, the chest rising and falling, breathing in, breathing out. And just being with the breath the way it is without changing it. Just noting the breath moment to moment, each breath a new breath. And as best you can, binding your attention to the breath. And now the third step is allowing your attention to expand to your entire body from head to toe, allowing your breath to recede in the background, bringing a more spacious awareness to this present moment. Noting any body sensations here, tightness, holding, relaxation. And just really allowing yourself to take in this moment. And when you're ready, opening your eyes and letting go of this breathing space. Giving you a moment to transition back into the room. So what is mindfulness? So Jon Kabat-Zinn, who brought secular Buddhism to the West and named it as mindfulness, is the component that he brought. He describes it as the awareness that arises from paying attention in a particular way. And particular with mindfulness is not just paying attention. It's paying attention with an attitude of openness, a friendly attitude, which is non-judgmental. A key intention is holding an attitude of curiosity, which is the antidote to judgment. And the nature of the mind, which as all humans is we constantly are evaluating, comparing, and judging our experiences to what we expect or what we'd like for our life. But when you actually dwell in stillness, we'll notice a judging mind. And even myself in that short practice noticed, certain thoughts. When people first start a mindful practice, the judging mind can show up as this is boring. I'm no good at this. I'm no good, period. Our likes and dislikes will pop up. Our attachments and avoidances will all show up. So the task in mindfulness is to simply witness whatever experience unfolds in the mind or body without expectation, just allowing whatever shows up to be there, whether it's an internal experience or it's the relating to the external experience creates an internal experience, and just allowing that internal experience to be there. It's an attempting to connect with the present moment through direct sensations of the experience, which is the thoughts, the emotions, the body sensations, without a desire of wanting to change it. It's really taking the experience for what it is directly. And then recognizing that thoughts that arise from an external experience are just thoughts. They're the thoughts we have. They're not necessarily facts, because our thoughts will change depending on our mood and the context. And just to realize all the thoughts we have are not facts, it's very liberating, because we come to believe our thoughts are very heavy, and then we get into the spiral of thoughts, which can just worsen our mood states. So mindfulness starts when we recognize this tendency to be on automatic pilot, and that we often live our lives through our heads versus directly through sensations. We live our lives, through an interpretation of events versus the actual events itself. For example, one of my mindfulness classes, I taught this one woman brought up this, it was a really nice anecdote, how she's been driving the same road to work for over a decade. And that particular morning, she noticed how the sun was rising, how beautiful it was, the joy she experienced from witnessing that. And she described it as a very intense experience. And then the next moment, she felt this sadness, thinking, she had a thought saying, it's been there all along and I've never enjoyed that. So it's interesting how she'll have a moment connecting directly to experience, and then the thought will come in saying, how is it that I didn't notice that? But this is how it is. We have lots of things floating through our head, and as humans, we tend to connect to life through our heads. So I think it's important to talk about what wellness or what well-being or mindfulness is not. It's not something that's you buy or is set up for you, and a setting that you have to be in. I saw this advertisement and I wanted to share it, because there's a sense that we need to go into a spa-like setting and be treated to nice meals and walk beautiful grounds to obtain this state. What I really want to highlight is a mindful state is always accessible. It's an internal state of being, and not something we acquire externally. And it's always accessible just by pausing and just taking a moment to check in with yourself. This cartoon is, I find, quite enlightening. So here's a character who has happiness, and the other, his friend comes along. Where did you find that? I've been searching for it everywhere, and I created it myself. Which it's similar to what I'm trying to get to, is it's something that's an internal state. But what is not accurate in here is mindfulness is a mindset where we welcome all, whether it is pleasant or unpleasant. It's not always necessarily happiness. If the goal of happiness is what we're trying to achieve, then it becomes a not allowing of what is going on. And it indicates that we're not happy with the present moment. So it is true that we do reach these states internally, but the goal is not always happiness. It's just allowing that life happens and we accept what is happening in the present moment. So mindfulness is exactly this. You go on a walk with your dog. You notice, the dog notices 4 trees and a sun. But the human has a lot of thoughts, a lot of worries, concerns, bills to pay, the occasional song that pops up, having to go to work. We're usually not present where we are, and we miss moments of joy because we are connecting to life through our head versus through our senses, through just seeing, being, and feeling in the present moment. So it's important to acknowledge the origins of mindfulness. Mindfulness is a form of vipassana or insight meditation, which is rooted in Theravada Buddhism. Vipassana is an observation-based, self-exploratory journey that focuses on a connection between the body and the mind. And I'm sure many of you have heard this mind-body medicine, where we try to relate the experiences in the body with the mind, and that they are very interrelated. And insight meditation is also described as a way of seeing clearly through direct experience as it folds. So in Buddhism, they describe the three markers of human existence, which all humans share. That the fact that we are on this earth, we all get our fair share of suffering, that nothing is perfect and suffering exists. But given that in life there is suffering, the second component of pain is resistance to this suffering. Now, the resistance piece is an optional piece, and this is where mindfulness focuses. So the resistance piece is the avoiding of the moment, wanting something else, preferring something else, or just having an aversion to it. To just allow our internal experience provides an internal ease. And all of a sudden there is a releasing. It doesn't change the moment particularly, but it does provide a sense of ease. The second marker is nothing lasts. Everything changes and is impermanent. So as humans, we tend to seek certainty in life. We get our house, we get our car, we think it's going to last, and things change. Things change every day, and the pandemic is a perfect example. Who would have thought we'd be going through a pandemic a year later? But in reality, things are always changing. Even during that short 3-minute breathing space, I noticed I was focusing on the breath. My mind wandered off. It came back. Things are always in this constant ebb and flow. The third marker of human existence is that it's all impersonal, that there's this universality of humans. I've had these thoughts myself where I say, why is this happening to me? You know, this person's having difficulty, I'm having difficulty with this colleague at work. Things tend not to be personal, but as humans, we do tend to personalize, and our thoughts are the ones that fuel these flames, where we compare, we'll judge, we'll story tell, and it will exacerbate our mood states. I think this cartoon is a perfect depiction of resistance. The following contains scenes of people not accepting what they cannot change. Viewer discretion is advised. So life can get very messy if we don't want to see what's in front of us. And I'll go through the reasons of why it's good to see. So given the pandemic, our life boundaries have just gotten smaller. Here we go, where work and home, same space, and we're trying to juggle all these things, and everything has become blended in with each other. And it's become very challenging. So we're trying to create these boundaries internally as best as we can. And that could be a challenge. So what do we mean by being present? So here we are with this webinar, present. Our body is present. And then there's the past and the future. So the thing is, with body sensations or your body, there is no choice. You can't move to the past moment or the future moment. It's always here. But the mind, your mind bubbles can float back. They can float forward. And that's where our worries and our anxieties will come in. Worries will be past, past history or what has happened yesterday. And anxieties is what's going to happen tomorrow, or hoping something that's not going to happen. And what is very important is that the thought process can definitely wind us all up. And sometimes checking in with yourself just involves moving your experience into the body and saying, where am I right now? How are things right now? And shifting your attention to your breath to disrupt these negative thought spirals that can start. So generally, there's two modes of life. There's the doing mode, which is good for external goals, and the second mode is being mode. So for doing mode, it's very good at problem solving. It gets things done. If you don't like your house the way it is and you want to renovate it, you shop for a contractor, you try to get things done and get materials, and you change your house and you fix that. But in being mode, for example, try saying this to yourself: I'm unhappy. I wish I were happier. And I hope these very difficult feelings never come back. What do you feel in the moment after saying that? I can tell you, I feel like there's a gap. I feel worse than before. When it comes to internal goals, being with these feelings and thoughts is much more effective. And just being with it without exacerbating it with a doing mode where I have to go on and change it, it usually is not very helpful. So in doing mode, it's often automatic, where we get old habits, mental ruts, things we grew up as a child. But being mode is very deliberate. You're deliberately shifting your attention to your breath. It's on purpose, it's intentional, and often it's to disrupt our thoughts. Doing mode works through thinking. We analyze, we need to fix our house, we think through and compare benefits and risks, pros and cons. But in being mode, we work through direct experience, where we sense and experience life itself. In the doing mode, we focus on past and future, most likely because we're comparing. We will usually are trying to progress to an expectation or a standard we set for ourselves. But in being mode, it's just about being fully present in the moment and allowing ourselves to witness our life as it is right now. Doing mode tries to avoid the unpleasant experience, and that's why we try to set up a goal to change it. But being mode approaches all experiences with interest and with curiosity. Doing mode needs things to be different. It's often just dedicated to change. We're trying to go on our trip. We're trying to change our house. We're trying to get in shape. The fact that we don't like things the way they are, and we want to set a goal which says there's this gap. But in being mode, we allow things to be as they are. And there's an underlying attitude of acceptance. In doing mode, we take thoughts and ideas as real, as if they were the same as life. But being mode understands that life is about sensations, and they just see thoughts as mental events, as sometimes old automatic patterns that we have. In doing mode, you focus on what needs to be done and ignore the undesirable side effects. But in being mode, we understand that if we take certain actions in life, that others could be hurt, and we're sensitive to wider needs. So I want to learn to live in the moment, just not this moment, some other moment, like a moment on the beach. And again, we all have these moments where we just don't want to be where we are. And I think it's important to say that the fact that we are here on this life, not every moment is going to be a moment we desire or want. We just meet each moment with equanimity or in an equal sort of attitude. So how do we be in the present moment? It sounds simple, but it's really sometimes not. It's a challenging thing to be mindful, to be aware. So as we go through the slide, we could practice possibly just being more aware. So to be aware is just noticing and witnessing and observing the moment, observing the colors of a slide, and then noticing how the mind wanders off. We go into automatic pilot, we have worries for tomorrow, and then we could have a spiral of thoughts where we remove ourselves and then we come back to the talk. It's controlling your attention as best as we can, being fully present, trying to discover things, seeing clearly, being very curious about what's going to be said. Emotional regulation, it's the fact that we turn away from unpleasant events, says we do not have, there's an aversion to it. Just creating a stance of willingness to be with whatever is presenting itself does provide an ease. And it alters your relationship to experience from this avoidance of moving away to observing. And just allowing the stance of observing empowers you to be more effective in the moment. Behavior regulation. So taking that moment of observation and noting what is going on, there's this pause that's built into the system, which allows you, instead of reacting, to respond. And it allows for the potential of increased pleasure, reduced stress, and possibly taking a course of action which you've come to regret sometimes. And that takes me to the next point of responding mindfully. It increases the ability to choose a skillful response, either a thoughtful action, or to say, to let go, intentionally saying, I'm not ready to deal with this right now, or to let be. If your child didn't do their homework and you're just saying, I don't have the space for this, just to let it be. And this increases the compassion for yourself and others. So self-awareness is a combination of these three pillars, where you set intentions, you, as best you can, regulate your attention, where you place your attention just as if you're placing something on a shelf, you're placing a glass of water on a table, then you're moving it over to the counter, and then you're carrying it with you. There's an intention to it. And it's the most important piece is the attitude. There's this curious, accepting, compassionate attitude that life can be challenging and difficult, and I am going to allow things to be as they are in this moment, just to see clearly. And as you see clearly, you become more effective in your response, which increases your skill set. I love this quote from David Rock in his book, Your Brain at Work. He says, you can experience the world through your narrative circuitry. You can also experience the world more directly, which enables more sensory information to be perceived and allows you to get closer to the reality of any event. Noticing more real-time information makes you more flexible in how you respond to the world. You also become less imprisoned by the past, your habits, expectations, or assumptions, and more able to respond to events as they unfold. And this empowers you as individuals in the moment at a time during a pandemic where most things are out of our control. What we do have control over is our response to events and how we experience them. So it's about the self-regulation of attention. So you may have noticed in that first 3-minute breathing space that we checked in the present moment, then we shifted our attention to the breath. I still noticed it myself, the attention wanders, and then you bring it back to the breath. The attention wanders again. You might notice where it wandered to. Maybe I have to get some groceries, or I have to deal with a particular letter or problem. and then it comes back to the breath. This moment of noticing that the attention has wandered and where it has wandered to is a moment of mindfulness. It sort of allows you to know where your thoughts are drifting and really what's on your mind or in your heart or what your concerns are. And this repetitive nature of bringing your attention to the breath, the nature of the mind is to wander, and then you bring it back to the breath. This allows you to regulate your attention, which leads to emotional and behavior regulation, which makes you very effective in life. So there is no right way in mindfulness meditation. It's a practice just to be with yourself, wherever you are, and with whatever shows up. It's not about emptying your mind or feeling relaxed or escaping pain or uncomfortable thoughts. It's about just being with, because this is your life and this is what's showing up. In mindfulness, we don't choose. We allow just to be with, and the being with these unpleasant experiences, which in Western society we tend to move away from, just this builds up a tolerance, a distress tolerance for difficult emotions, difficult mood states, and difficult events. And that being with brings an ease to your life. So it's a sort of a turning towards versus a turning away to what is present. So the benefits of mindfulness, it can help you live more in the present moment. It's the potential to increase awareness of the thoughts you're having or the types of thoughts you're having. Most of us will have this repetitive tape that plays or this judgment we have against ourselves. And it's just coming to know this repetitive thought that's probably not serving you. And just to sort of say, okay, oh, here it is again. And then bringing yourself back to the present moment. Noticing emotions, patterns of mind. And by doing that, it alters your relationship to experience in a very profound way. It improves attentional regulation, which can strengthen your emotional regulation. So instead of allowing your attention to drift away in the thought spiral, you can take your attention, like you, again, taking that glass of water and shifting it to the breath and disrupting these negative thought spirals that can start. And that can settle the mood and at least not accelerate it. And what's amazing, it allows a different way to experience life. It reframes things cognitively, which is a very powerful technique. And doing this will reduce symptoms of stress, anxiety, depression, and burnout with improvements in well-being. There is so much literature supporting mindfulness at home, mindfulness in the workplace, mindfulness in schools. They're doing mindfulness in prisons, everywhere. Like it seems like the be all and end all that'll fix most of societal problems, but it really has been, there's a vast amount of evidence that promotes sort of the implementation of mindfulness programs in many aspects of society. And just since we're all healthcare professionals, to show that there are mechanisms by which mindfulness works, and there are changes in the brain as shown by functional MRI. When there's body awareness and emotional regulation, there's prefrontal cortex changes in the amygdala. And just to say that neuroscientists is probably one of the most studied topics in neuroscience, which I didn't take you through all the neuroscience of it all. So what can we do? Starting in this present moment, of course, is there are formal and informal practices. So formal practice would be a sitting practice, a body scan, a walking meditation where we're intending to sit and be with. But most of us lead very busy lives, and it's sort of integrating a mindfulness attitude to your daily events. So if you're sitting down to have your meal, just mindfully being with your meal, sort of putting the technology to the side to really taste your food, to be with it, and to sort of bring yourself down in terms of mental stimulation. Mindful running, mindfully talking, like choosing your words, being present. And these things could all take minutes. In terms of a good introduction to Mindfulness. This book by Gunaratana is Mindfulness in Plain English. So one thing that's important to note is mindfulness, we can talk about it. I can discuss it here. You can read about it, but this is critical for mindfulness. It's that as long as you keep in mind that the words are only fingers pointing to the moon, they are not the moon itself. The key is practice, practice, practice. These changes that occur in the brain occur from just sitting and being with yourself and noticing. And this is what creates this overall change in brain functioning and alters our experience with life. There are formal courses you can take. John Kabat-Zinn created the mindfulness-based stress reduction. It's an 8-week session. I think he created it back in the 80s. And then mindfulness-based cognitive therapy is something that's been created in the early 2000s. The indication was for depressive relapse and anxious states. But I've noticed that many people will come to these MBCT courses that have no formal diagnoses, just know that they're not relating to life the way they want to relate to life. And there's great benefits that they've noticed during practice. So there's no quick way to achieving mindful states. It's something we practice. No shortcuts to inner peace. Being with ourselves is not an easy task. I've been doing this for years, and I'll have up and downs myself. This quote by John Kabat-Zinn summarizes life very nicely, that you can't stop the waves, but you can learn to surf. So the waves of life will keep coming. We're just learning a different way to be with these moments. Initially, it can feel challenging turning towards what is unpleasant, but what you'll come to realize that you have this tolerance for distress, and you're able to get to know life in a different way, an ease, which makes things much more pleasant to experience. So some suggestions, what you can start to do is, when possible, just do one thing at a time. Pay full attention to what you're doing. And when the mind wanders, gently bring it back. Each time we notice we've been lost in thinking offers a precious opportunity to practice the move from doing to being. And this is a way of freedom in terms of your emotions and your mood states. It just gives an ease to life. Taking moments of pause through your day, just taking a breath for yourself. Often I will take a mindful walk as I go from my lunch back to the operating room. It's just a very slow paced, being present. It just resets me to be more aware. Bring awareness to routine activities through your day, taking a shower, walking. One thing I do and I like doing is when I park my car, I'll take a moment to transition as I sit in the car before I come into the house, or even as I park at work. I just bring a sense of awareness, and it helps me transition into my various modes of life, whether it be mom or doctor at work or friend. It allows me to be more present. And choosing a buddy to do a mindful check-in with on a regular basis, we tend to ignore our needs. And I think it's important that we give ourselves this gift of time, whether it's seconds, minutes, or longer. It's allowing yourself this gift to be as you are without the need to change yourself. So it's important to just realize mindfulness is a process of discovery, and it's a way of being. We don't know where the path leads, but it's just a sense of allowing to be with. And this just in itself provides a sense of ease. Thank you.
Thank you very much, Dr. Basran. That was, again, really well done. And I certainly learned a lot tonight of how kind of poor my knowledge on mindfulness was. You think you understand it, but actually I didn't until listening to you speak tonight. Do you have any recommendations of some tools or apps or YouTube videos that can help guide someone through a mindfulness exercise?
Yeah. Yeah, so Headspace and Calm are very common apps that are being used by many. The Center for Mindfulness Studies has guided meditations that are used. The thing is, when you go into YouTube and try to listen to what's defined as mindfulness, there's a setup for a goal of relaxation. And sometimes relaxation is very hard to achieve. And where people give up on the practice is they felt like they failed because they didn't get relaxed, or they didn't experience what they wanted to experience, which makes it a doing mode. In mindfulness, you're just being with whatever shows up. So if you had a particularly challenging day, everything felt hard, parenting felt hard, that's how it is. And just giving yourself the permission to have that moment. And I think in the guidance of some of those, if it's not done right, it can give a sense of failure or that gap that you're missing something. So I would highly recommend the Center for Mindfulness Studies, or there's this, I forget the name of it, from San Diego. There's any Center for Mindfulness Studies understands the principles of mindfulness, and they'll probably do it in a sense which doesn't set this expectation of what it should be.
Okay, thank you. Thank you so much. Thanks for joining us again, Dr. Riehl. I just had a quick question for you. Well, if there's anybody else that does have a question, they'd like to raise their hand, they're welcome to join us in the question and answer period. But my question was, sometimes it's difficult to approach somebody that maybe you think is struggling with some of the issues you brought up. How would be the best way for us to kind of gently approach somebody to show our concern and maybe identify the problem?
Yeah, so, I think about the times when, we are greeted by somebody and we literally just say like, oh, how are you doing? And we just, we don't really mean that, it's just courtesy. How you doing? Sometimes we have to, and again, the pandemic and working from home can make things differently. But if you really do have concern for somebody, it can be so meaningful to literally, whether it be you are in person with them, if you're vaccinated and you have that opportunity, or you're masked at work, or if you reach out to them via text or a call and say, hey, I just really want to check in. How are you doing? And you give them some space to kind of literally recognize, oh, somebody actually wants to know. And you can validate for them in a very mindful way that it's okay if you're not doing okay. And I'm not here to solve the problem for you. I could just be here to listen to you. And that space of giving somebody permission to just talk and feel heard and validated can really open the door for maybe a further intervention, maybe another conversation. So really, I think being aware that you don't have to go in with providing a solution for somebody, but that just asking, how are you doing? And giving them the space to answer can be really powerful.
Yeah, very good. Thank you. Excellent answer. Is there anybody out there that would like to ask a question? I think we have a really quiet group tonight, and you must have answered all of our questions extremely well.
Not that everybody had like really short, easy days too, right? Like
yes, I reckon.
By 8:30 on a Wednesday or Tuesday. Well, I don't even know what day it is, but
Thank you again to our speakers. What a lovely evening, and I thank you so much for sharing your time and your expertise and experience with us because it's such an important topic. I'd also like to thank again Takeda Canada for their sponsorship of tonight's program. And on behalf of CANIBD and the steering committee, I'd like to thank everybody for attending and sharing their evening with us. And we look forward to our next event. Okay, everyone have a great night and we'll see you again soon.